Welcome to Fuzzybutts and Friends. Whoop, as much as it drives Fuzzybutts all over this place, absolutely crazy when they hear me say it. I am the host of this show, Yer Big Dog, Luke Robinson, back again with you this week. And also back again with us is Ginger Morgan. She's the co-host of the Fuzzybutts and Friends podcast, and she's also the executive director of the Puppy Up Foundation. Ginger, how are you?
I'm doing well, Luke. How are you this fine morning?
I'm doing excellent. We'll get to it in a second, but we've had a lot of things going on with my Fuzzybutt for Indiana, and sort of a mixed bag. Good news, some questionable news, but it certainly is germane, Ginger, to the topic of discussion today. There's Fuzzybutt number 4 right there on Ginger's screen. She's down there. He's down there in the Morgan Manor. That's where he hangs out during the day. So that's why I'm excited, Ginger, to have our guest today, because it's particularly relevant to my Fuzzybutt, Indiana. Our guest today, everyone, is Dr. Sharon Campbell. She's the medical lead of Canine Chronic Pain with Zoetis Animal Health, a wonderful, wonderful company doing wonderful things. Dr. Campbell, welcome to Fuzzybutts and Friends.
Well, thank you for asking me to be here. I'm happy to be here and meet the both of you.
And the other, nice meeting you as well.
Meeting you and your Fuzzybutts. So
yeah, well, speaking of Fuzzybutts,
not your Fuzzybutts, your Fuzzybutts that belong to you.
Ginger has like 20, Ginger has like 20 Fuzzybutts, and they're like stuck away in different parts of her house. So speaking of Fuzzybutts, that's exactly how we like to start the show, Dr. Campbell. Do you have Fuzzybutts of your own?
I do. I have Huckleberry, who's sitting here behind me on his little bed, trying to keep him over here because we've got the landscapers out there, and he doesn't like people being in his yard. So
what kind of kid is Huckleberry?
So he is an English Shepherd. He looks a little bit about a cross between a Husky and an Australian Shepherd. So he's black and tan, has a thick coat, and he gets shaved every summer. Because he does not tolerate the heat. But yeah, his official breed is English Shepherd. But it's not a common breed. Yeah, it's not a common breed. So I usually say, well, think about a Husky crossed with a Australian Shepherd, and there you have my dog.
Well, that was the picture that came up before you popped on your video feed.
Yes,
right?
That's
he
him.
certainly is a handsome boy. How old is Huckleberry?
Well, that's a good question. I got him as a rescue, so we think he's probably about 8.
8. So he's getting about that age where he's lucky to have you as his parent, because as you know, dogs that are getting older, as you know, as every one of us knows, they tend to have more structural problems. And that's what's facing Indiana, is that he was DX with osteoarthritis.
Okay.
I guess he was diagnosed, I think, about a year ago. And so we're really excited to talk about with Zoetis, what you and Zoetis have going on over there. Sounds like it's revolutionary, your new therapy treatment. But before we get into that, Dr. Campbell, all that, we have lots to talk about. Let's start out with your origin story. How'd you end up taking care of Fuzzybutts?
So actually, as a child, I always loved animals, and I always wanted to be a veterinarian. I took a little bit of a circuitous route to get to here, but I went to veterinary school at the University of Wisconsin. It was a brand new school at the time, so that was exciting. I was in the 2nd class. I did a residency in internal medicine at the University of Tennessee, and I worked in a private referral hospital. I'm a specialist. I'm boarded in internal medicine. And so I worked in several different specialty hospitals for several years before joining, at that time was Pfizer Animal Health. Now it's known as Zoetis.
Excellent. It seems like every veterinarian that we have on here proves, I just thought it was kind of like an old wives' tale or something like that. It just proved that they all start off young wanting to take care of animals. That's always seems to be
pretty much. I would say 95%.
It's the rule rather than the exception, that's for sure. Well, you're certainly doing some really important work at Zoetis, Dr. Campbell, and that's before we get to that, let's talk about Zoetis. That's a relatively new drug company. How long? I assume it was acquired by Pfizer, correct?
So no, we originally were Pfizer Animal Health, which has been around like all together with Pfizer Animal Health and the different companies that were part of Pfizer Animal Health. We've been around for about 60 years or so. We've been known as Zoetis since 2013, so just about 10 years. But the whole structure of our company was initially rooted in Pfizer, and then they spun us off because they felt that they wanted to focus on human health, and they wanted us to be able to do our own thing and focus on animal health. And that's actually worked out very well for us.
Yeah, so I got it reversed though. I'm dyslexic. I do that often. Is that rather than acquire you, they spun you out as a
They
separate.
spun us off.
They spun you off.
Yeah,
Exactly.
it's like a top.
So you've been around since 2013, or you've been spun out since 2013. What is the focus of Zoetis? What are the major illnesses that you're looking at there?
Yeah, so we have right now we have three major pillars. So we have our dermatology portfolio, which primarily includes our Apoquel and Cytopoint, as well as our anti-infectives. We have our parasitology portfolio, which includes Feline Revolution, ProHeart 12, Simparica Trio. And then we have our pain portfolio, which is comprised of Rimadyl and now Librela for the dog, and then Silencia for the cat. And then we have a whole group of drugs, which just a big lump of drugs that deal with anesthesia, but that's not our primary focus. Our primary focus right now are dermatology, parasitology, and pain management.
Well, that's a nice portfolio of pharmaceuticals and therapies. Indiana is already, he's a use case already. He's on Rimadyl. We had him on
Oh,
Galliprant, but we went with the Rimadyl and gabapentin to sort of achieve a synergistic sort of effect. And Rimadyl was really a game changer for pain management in pets. Was Rimadyl, remind me, was Rimadyl the first NSAID?
yes, it was. Yep, it
Wow.
was approved in 1996. It was the first NSAID available to treat canine osteoarthritis. It was for the relief of the pain associated with canine osteoarthritis. And then since then, there's been several other NSAIDs that have been approved, Galliprant being the most recent one, which I think that was maybe 2016 or something like that when Galliprant was actually approved.
So pain management is a major focus of Zoeta, and I think that's such an important topic, Dr. Campbell. I've lost three of my kids, my Fuzzybutts, to cancer, and so I've dealt with a lot of pain. I've seen more pain, I think, than most parents should ever have to see, and it's a tough thing because what I've learned throughout all of it is that obviously companion animals can't communicate to their parents what ails them, what's hurting, what's not. And so, unlike humans, it's just an entirely different field, just measuring the metrics of pain management. So, can you talk to us about pain management in our companion animals, please?
Yeah, and you hit it right on the head, the nail right on the head, and that the first step is diagnosing it, right? And dogs and cats are so good at hiding that pain, or those changes, and it's typically changes in behavior, and those changes in behavior can happen very gradually to the point where often what we hear as veterinarians is that, oh, he's just getting old, he's slowing down, he's getting old, when the reality is their behaviors are changing not because they're getting old, but because they have osteoarthritis and they're painful and it hurts to do all those things that they usually used to do. So, and if we think about what are those things they usually used to do, pet owners often think that if the dog isn't limping, then they're not painful. But limping is very rarely a sign of osteoarthritis. It's usually more a sign of like acute kind of trauma to the limb versus osteoarthritis, which is a chronic ongoing disease. And so the things that we see where dogs, it's basically they stop doing what they used to do, is they have a difficult time going up and down stairs, or maybe they have a difficult time jumping in and out of the car, or even jumping on the couch. They could have, they may be reluctant to walk, or maybe they just don't walk as far as they used to. Or what you might notice is that when they get up from their bed, they often will have like they're kind of creaky, you know. They take a difficult time to get up from their bed. And just like when you know that that's pain, it's hurtful to watch because you just know that, oh, that dog's just having a difficult time because everything aches. So those are the signs that typically are seen. And again, because they're really subtle and they happen gradually over time, oftentimes people just say, oh, he's getting old and disregard it.
Yeah. What percentage? Well, I want to go back about pain management in companion animals. Is that I think that people just don't, pet parents just don't understand is that nature designed what used to be feral animals to not show pain in nature because of their concerns of predation, and
Mhm.
so that's what makes it so hard. But what percentage of geriatric dogs are you seeing out there, Dr. Campbell, that have osteoarthritis? I think it's a big problem, right?
Yeah, it's about 40% of dogs have osteoarthritis or actually have pain associated with osteoarthritis. And that's really the pain associated with osteoarthritis is really what we're able to manage. And that's really why we want to educate people that all of these different behaviors are indication of osteoarthritis, but it's really the pain associated with osteoarthritis that is really the problem.
Well, how do you differentiate? Okay, let's use Indiana as a use case. Is that Indiana got an X-ray? He was just slow, like everything you just said a second ago.
Hmm.
He was symptomatic of that. He's slowing down. He doesn't jump up on the couch as much as he used to, and so on and so forth. And so we took him in, I think, a year ago, and had maybe a little less than that, had him X-rayed, and there was an indication of osteoarthritis. But how do you take? But he's Indy's 12, so we kind of expect to see that, and the osteoarthritis wasn't that pronounced. It wasn't that pervasive. And so, how do you differentiate, or how do you diagnose a dog from having the actual clinical signs of osteoarthritis, but not being symptomatic from pain? How do you differentiate? Is that you treat, and then see their response to that? How do you do that?
So different ways, right? And it depends upon the dog, it depends upon the owner, it depends upon the veterinarian. Oftentimes, it's good to get confirmation that if the dog is slowing down, showing all of those behaviors that we just discussed, it's a good idea to get. And then, what will happen next is that the dog will come in, the veterinarian will do what they call orthopedic exam. They'll, you know, manipulate the limbs, check for the range of motion, all of those different things to identify the joint or joints that are affected. And then oftentimes what they'll do is they'll recommend, let's take some radiographs because you want to make sure that it is osteoarthritis and not something else. So what could that something else be? It could be an infection. It could be, hopefully not, but it could be bone cancer. So you want to rule all those things out. And then we'll see the changes associated with osteoarthritis. And once you have that diagnosis, then you can go ahead and treat. Now, that's one pathway. Another pathway might be given the breed, given the age, given the signs, and given the changes on physical exam, the veterinarian may say, well, there's a high degree of suspicion that your dog has osteoarthritis. So let's go ahead and do a pain trial. We're going to put him on a analgesic, likely it's a non-steroidal anti-inflammatory, and let's check him in 2 weeks and see if he's better or see if she's better. And then from there, they can say, okay, it's likely osteoarthritis. They may or may not get a radiograph to confirm that, but oftentimes the radiographs are good to get because then you can measure progression, but radiographs aren't perfect. So often the other thing that is confounding this whole diagnosis is that the sometimes you'll see a dog that has what looks like really advanced osteoarthritis and the dog doesn't seem to be painful. And other times you'll have a dog that'll just have just really minor changes associated with osteoarthritis on the x-rays, and the dog is really painful. So the changes in the radiograph and the degree of pain do not usually, don't always line up. So that's where the veterinarian's expertise comes in to help with the diagnosis and the treatment plan.
Right. I know with me is that Indy's been in to see a physical therapist, board certified physical therapist, and acupuncturist, and also a chiropractor because my philosophy is just I want as many hands on him as possible to see to try to figure out where he's hurting and if so how. But before we kind of dig, I guess, delve a little bit of further into osteoarthritis and your wonderful, promising new drug, Librela. Talk to us about the mechanism of action of osteoarthritis. I think we all have a general understanding of what arthritis is, but I think there's probably a lot of us, maybe myself included, that what really is going on at the physical and molecular level.
Okay, I do want to just drop a little, we'll come back to it, but what you just mentioned about what you're doing with your dog is very important. That's called multimodal therapy. We'll talk about that at the end, but I just want to make sure that we come back to that
I'll
because
make
that's
it up.
very important.
Okay.
But so osteoarthritis really starts off with some type of we call inciter, right? And what is that? That could be a conformational change. It could be the dog is overweight. It could be some type of trauma. And that, whatever that is, that puts undue stress on the cartilage of the joint, which is the covering of the kind of, it's sort of, think of it as a cushion on the end of the bones where the bone meets bone. So where you have a joint, say your knee, where your femur and your tibia come together, both of those bones have a covering called cartilage. It acts like a little cushion. And any of those inciters can actually cause trauma to that cushion. That cushion's made up of cells called chondrocytes. And those cells, when they get traumatized, get a little angry, and they start secreting different materials, which we call how's the best way? So fancy names for them, but they're actually kind of destructive molecules that then go in to cause some irritation of another part of the joint, which is the lining of the joint, which is called the synovium. So
So
that's like the first step.
it's basically all of the cells that are a part of the inflammatory process, right?
Right. And so that synoviocytes, then those irritating molecules that are secreted by the cartilage then cause irritation of the synovium, which is that lining. And then those start to secrete a lot of different molecules as a response. And some of those are inflammatory mediators. Some of those are a nerve growth factor, which is important. We'll talk about that. And then you get this vicious cycle because there's what you have with osteoarthritis is that usually if you have trauma to something, the body tries to repair it. But in osteoarthritis, that kind of gets out of whack. And so what you have then is this vicious cycle of these inflammatory mediators, then further causing degradation of the cartilage, which then further secretes these irritating molecules, and then of course all of this is then causing pain in that joint.
And that's why NSAIDs then are so effective, obviously, because non-steroidal anti-inflammatories is they attack or address the inflammatory process itself.
Yeah, so by the time we see the dogs that have osteoarthritis, that hot inflammation that you see at the beginning where there's that initial trauma, that's sort of quieted down. So you have more of a kind of a low grade inflammation. And so NSAIDs are doing two things. They're actually addressing that inflammation, but more importantly, they're addressing those pain signals that are being driven by that joint because of the irritation and the kind of the joint actually starts to break down, and that's what's causing the pain.
Right.
And
Well,
all of those different stimulants.
absolutely. One of the things that we know about Indiana is we know that there's an inflammatory process going on because when we made this switch from Galliprant to Rimadyl, there's a 72-hour clearing process where you have to clear the system of the previous NSAID, and Indy just basically was wiped out. He couldn't even get up, and so. Yeah. We started him on Rimadyl, and he perked back up almost immediately once it was in his circulatory system and he was absorbing it. But the inflammatory process is so destructive. It's so important, obviously. Know that, but it's so destructive. Like you said, it can't be so destructive.
Right, absolutely. And then without intervention, like giving them something like Remedial, like you did with Indy, you just get that vicious cycle of destruction. And then the joint tries to respond. So you get proliferation, and then you get that pain. And it's just sort of that vicious cycle. And you have to really do something to intervene there to slow down that whole process.
Yeah, because as you said, is that if left unaddressed, then over time that will break down the joint. That entire area will break down, even deteriorate even faster, even more so.
Right. And eventually people don't think of the joint as an organ, but it is. And so what you see is that that joint actually fails. You go into organ failure of the
Wow.
joint. So yeah.
I don't think I need any more organs. I don't think any of us need any more organs that go into potential failure.
You're
but
gonna fail.
but I never thought about that being an organ structure. But you're absolutely
Mhm.
right. Okay, did you want to talk about multimodal therapy now, or you want to talk about Librela? I'll leave it up to you.
So I think it might make sense to let's talk about Librela, the different
Okay.
things because if you think about osteoarthritis, what we're seeing, the changes that we're seeing associated with the dog are really due to that pain that's being generated for osteoarthritis. So before you can do any of the other parts of the multimodal treatment, you really need to address the pain. And there's a
Got
couple of ways that you can do that. There are several drugs that are approved for that. The one being the whole group of NSAIDs that we've already talked about, Rimedo being one of those. And then the other one is the new one is Librela, which is a monoclonal antibody. Its trade name is betenvetimab injection. That's a mouthful. I know it took me a
it.
while to be able to that rolled off my tongue, but betenvetimab injection, and it is a monoclonal antibody against one of those mediators that is being secreted by the synovial cells and other cells that are part of that osteoarthritis uh, uh, cycle, and that is nerve growth factor. And nerve growth factor, as we know, is now, we didn't know this before, but as we do more and more research into the pathophysiology of osteoarthritis, we know that NGF is a huge player in the generation of pain. It also has a role in indirectly in the inflammatory response. And so it's a bad actor when it comes to osteoarthritis, and it really needs to be stopped. And that's what Librela does. Librela, as a monoclonal antibody, will bind up NGF. That's important because nerve growth factor NGF, how it causes pain and how it causes inflammation is by binding to its receptor, which is just TrkA receptor, just for those that like all the detail. TrkA stands for tropomyosin receptor A kinase, and it is binds to that, and that's binding to that. It then kind of uniquely, it forms this little complex, and that complex gets internalized into the nerve, and it goes up to the nerve body, which is sort of where the kind of you think of it as the kind of the brain of the cell, if you will. It's where all the action happens, and what that does is it causes this um, upgrading or what we call a wind up of the whole nervous system and causes not only that initial pain signal be carried through, but also any other pain signals to be amplified. So we call that a sensitization of the nervous system. And that happens in the periphery. So in the cells that take that nerve signal up to the spinal cord, and then another group of nerves take it up to the brain, but it also causes sensitization of that part of the nervous system, but also sensitization of the central nervous system. And that's where the chronic pain becomes difficult to treat, because you've got this whole, you not only have the inflammation, but you have this whole wind up issue associated with the pain, whole pain pathway. And so what Librela does is by binding NGF, monoclonal antibody binds to look at, um, uh, binds to its receptor. No, so Librela binds to NGF, so it can't bind to its receptor. So then you don't get that winding of the nervous system or the wind up the nervous system, but it also prevents some its contribution that NGF has to inflammation within the joint.
Right. I know Ginger is our resident scientific expert, and I know she knows everything about monoclonal antibodies. But me, I'm a big dumb dog. So for my benefit only, why don't you talk to us in broad scope? What are monoclonal antibodies? How are they developed and produced, and so on and so forth?
Yeah, sure. So monoclonal antibodies are so you have antibodies in your body, right? And everybody knows about antibodies now because of COVID, right? The awareness of infection and everything has become aware, and so you have multiple different multiple different antibodies. What we were able to do when we developed Librela is we were able to from a canine immune cell, we were able to stimulate it to actually produce lots of different antibodies. And then we picked one, let's just say one family of those antibodies that all look the same. So they were all like duplicates of each other. And that we found that particular antibody, we call it monoclonal because it's just one antibody family, right? And that one, and we had a whole bunch of different ones that we looked at, but the one that we selected to be part of Librela was the one that blocked NGF and controlled the pain associated with osteoarthritis most effectively. So monoclonal means that it's just one family, they all look the same of antibodies. And they act similar to your antibodies that you have in the body, that it attacks something. In this case, it attacks NGF. And then it also acts similarly to other antibodies, and that there's just a big giant protein. And so how it's getting broken down is by within the by what they call catabolic methods. It gets broken down into like proteins and amino acids. So because of two things, it's very targeted. It goes just for NGF. And because it has a pretty straight design to be broken down, it is potentially safer than other drugs because other drugs are not as specific to binding to one thing. And other drugs often have involvement of the liver and kidneys and various other organs to help break them down.
Yeah,
So
I think
that is
that. I'm sorry.
yeah,
Go ahead.
go ahead. No,
I
no,
think
go
that's
ahead.
I think that's important though. I wanted to touch on that before we moved on. I think that's really important. I wanted to underscore that is the targeted aspect, because when you give oral NSAIDs, that's not specific or targeted towards anything. It's just a general anti-inflammatory, and as we know, the immune response plays a very critical factor in so many different ways, and you don't want to obtund that or restrict that or affect that. And so that's why I'm so excited about Librela is it's targeted therapy. But one question I had, or a point of clarification I wanted to ask you for the audience, is it's also local. It's a local treatment, right? The monoclonal antibodies are administered or injected locally in the area of question. Is that correct? Or is it systemic?
No, actually, it's a systemic, and so
Okay.
it's administered subcutaneously, in a manner similar to what you would give a vaccine. And then it quickly distributes to the body. It stays pretty much in the serum. Some of it does go into the joints and binds NGF to the point where we're eliminating the elevated levels of NGF that we see in dogs with osteoarthritis, but we're not eliminating all of the NGF because NGF still has an important factor
Right.
in different functions of the body. Otherwise, we wouldn't have NGF, right? So it plays an important role. And so the point of Librela is to bring the levels of NGF back down to a normal level. So it only takes away that excess NGF that's causing that joint pain, but doesn't interfere with the normal functions that are associated with NGF.
Well, how that's wonderful. How many treatments are required over what period of time? Give us a breakdown of that. How it's what the therapy looks like, the treatment looks like.
Sure. So it's an injection, as I said before. It's given by the veterinarian or the veterinary technician, depending on usually on the first exam, it's given by the veterinarian. And then, depending upon how the clinic's set up, it may be subsequent injections may be given by the veterinarian or the veterinary technician. It is given once monthly. And what we typically tell people is that although efficacy may not be seen until after the second injection, some dogs may actually see a response to therapy as soon as 7 days after the first injection. So again, we're going to have a variety of response to the drug because of different degrees of severity of osteoarthritis, how different dogs react to the drug, etc. So we want to set expectations. It may take the second dose, or you may see some soon after the first dose. But we like to set those expectations so that people we don't want to overpromise and underdeliver, but we just want to say, here's what we've seen with dogs, both in our clinical studies and in Europe and in the rest of the world where Librela is already available. So we just want to let you aware of this is the type of response that you would see.
So it's already available.
Would you use Librela with Rimadyl, or does it replace Rimadyl?
So you could use it in a place of the nonsteroidal anti-inflammatory drugs, and that's typically it depends, right? So the beauty of medicine and why I love medicine so much is that there's no hard and fast rules. It's like baking a cake. Each cake is a little different, and you can use different ingredients to maximize the taste and the appearance of the cake, right? And so if you think of management of osteoarthritis, which we'll get to next, the first start is analgesia. Oftentimes it can be an NSAID or as a first line treatment or Librela. They are equally recommended from different pain management guidelines as what we call first line treatment. So the advantages of giving Librela is that one, it's an injectable, so the pet owner doesn't have to worry about giving any pills at home. And we know that as well-intentioned as pet owners are, it's not infrequent that they'll miss a dose or two. I do that myself with my own medication, right? So compliance is huge. And just ensuring that the drug gets into the dog is really huge also. For other reasons, we see that pet owners may not be able to pill their dogs. Some dogs are very difficult to pill. And then, in some dogs, it may work better than other treatments. So there are a number of different advantages to Librela. And it really comes down to that conversation between the pet owner and the owner as to, let's start with the analgesic. Do we want to use something like Rimadyl, a nonsteroidal, or something like Librela, which is an injectable? Basically, you can go home and not have to worry about treating your dog until you come back next month to get your next injection. So it is an injection that's given once monthly.
I've got to go back to something you said a second ago about the mystery or uncertainty of medicine is really quite beautiful. As a pet parent, I don't think that's true because I would be the utopia for me is that 100% of all cancers have 100% efficacy, on a oncology drug or a treatment or therapy. It'd be great, actually, from a pet parent perspective, it would be great if a certain medicine or a certain treatment worked 100% of the time in every case. It would make our job as parents a little bit easier. But I understand your point, though. The human organism or organisms, they're just so vastly complex. And you take something like the inflammatory process in osteoarthritis, and like you barely touched on, there are so many different cytokines. There are so many different proteins. It's a cascade of so many different things going on, and that's why we don't see the expected results in every case. Well, speaking of efficacy, how efficacious is Librela based on what you're seeing in Europe and some of the use cases over there?
Yeah, so we do a lot of market research with veterinarians because we're really trying to follow up how Librela is doing. And right now, Librela is the number one analgesic being chosen by veterinarians in Europe over all of the other NSAIDs, as well as any other non-NSAID like treatment that veterinarians may use to treat. And this is just therapies. We're not talking about that multimodal approach, which is weight loss and exercise and all those other things. But as an analgesic, we're finding that Librela is number one in Europe, and that's in just 2 years. And I think that one goes to the effectiveness of the drug as well as the ease of pet owners not having to worry about giving medications at home.
Got it. Do we
How
do we?
long has it, how long has Librela been approved in the US?
It's been approved in the US since, I can tell you, I remember the day like it was yesterday. It was May 5th, but we do not have, it's approved, but we will actually have drug available this fall because once you get approval, it takes a little while to get everything geared up so that you can get the drug onto the market.
Congratulations on the FDA approval. That's quite an ordeal and costs a lot of money. It takes a lot of time. How long have you been, how long has Zoetis been working on this?
So we've been working on monoclonal antibodies for dogs with osteoarthritis since about, I'm going to say like 2011.
Okay.
We had a couple of candidates in there that didn't quite meet our quality, and it took us a while to get the right one. But now we do have the right one, and since 2011.
Very
Yeah.
cool. Well, I think that's important for our audience to know. So it's taken 12 years to go from picking the target and getting the right monoclonal antibody and then getting it to market. That's a long time, a long process, and it's a lot of money. But thank God Zoetis is doing that for companion animals because as you know, historically, dogs got everything that the people got and weren't using anymore. That's what pets got. That was their therapy. So, and it is the first monoclonal treatment for. Is it the first monoclonal treatment approved by the FDA for dogs or any companion animals?
So that's a little tricky question. All
Yeah, it
right.
is.
So,
Yeah.
so it's the first monoclonal antibody approved by the FDA for dogs, but it's not the first monoclonal antibody for dogs because the first one was Cytopoint, also a Zoetis drug, but that was approved by the USDA. So a little different path to approval. So that's why that's a tricky question. So we have the first one was Cytopoint approved by USDA. Second one now is Librela approved by the FDA. And then in between there, we last year we got approval of a feline monoclonal antibody for osteoarthritis, Silencia. So we are number one company in making monoclonal antibodies. We've got 3 of them out there now.
That's interesting. Cytopoint is an allergy, dermatology. Why was it, just out of curiosity, just to appease my intellectual curiosity, why was that approved by the USDA as opposed to the FDA?
So there's agreement between the FDA and the USDA as to what gets approved by which company, which group, and the USDA is in charge at veterinary health is in charge of approving vaccines.
Okay.
And so since there was some immune modulation associated with how Cytopoint works, that was through agreement between the FDA and the USDA that was approved by the USDA. Since R is for the control of a disease such as osteoarthritis, that falls under FDA mandate as far as approval process.
Yeah, and this is disease management. It's one of the questions I was going to ask you, Dr. Campbell. We're talking about a lifetime of injections, right? Every month for the remainder of their life, correct?
Correct.
Yeah. Well, that's good though, because well, as I get older, I appreciate that I'm probably going to hurt for the remainder of my life, and anything that's going to help that for the remainder of my life, sign me right up. What do you have any exciting use cases or success stories, Dr. Campbell, that you'd like to share? Dogs that were debilitated and really.
Sure. Sure, we do have some great cases. And so one of them is a little dog called Shiva. from Germany, and we have these great videos of Shiva, and it just trying to see her get up and walk around. And it's just painful to watch her, right? And this was before Librela. She was on an NSAID. She was on a couple other medications, and nothing was really controlling her pain. And then the next video we have is 7 days after her Librela injection, and she's not running, but she's obviously walking much more comfortably. Um, and then what we have after that is a video of her a month later. So it's after her second injection, and she's actually running. And it's something she hasn't done forever. Now, one caution that I want to give to pet owners is that even though it was great to see Shiva run, we would prefer these dogs gradually work their way back to where they used to be. Because think of it, if you have, if you have a hip replacement, right? Which is okay. So Librela is not the same as a hip replacement, but it's probably one of the things that people can most relate to. So if you have a hip replacement, the next day you're not going to go out and run a marathon. Like it's just not, you have to go to rehab, you have to build your muscles back, you have to get those joints lubricated again. Like you have to get everything working before you can go run. So we're actually have available for veterinarians to hand out to pet owners what we call back to play recommendations, and it gradually recommends different exercises that pet owners can do with their pets at home to build those muscles back up. Gradually increase those walks over time, so that like over a 2 or 3 month period, you get that dog back up to the point where then maybe it is okay for them to go run on the beach again. But we don't recommend that. Either dogs will feel well enough to do that, but hopefully pet owners will restrain them from doing that, because then they can injure other joints, because the joints are just not ready for that type of activity.
Right. Well, it really is sort of an impossible expectation, though, that for you to have of your companion animals when as they're getting older, when they go from 11 to 12 to 13, that they're going to even maintain status quo. It just doesn't happen. And entropy affects all of us, as you know. And so the only thing that we can hope to do is slow it down, or at least that it doesn't cause as too much pain where we can't function and have that quality of life. And that's what I love about Librela is that it gives pet parents like myself, where you have Indiana, where thank God, knock on wood, he didn't have cancer that's causing his mobility. You can kind of see him struggling back there to stop on around, but thank God it doesn't look like his cancer causing his mobility issues. It really is just pain. And I want to have him around and happy as long as I can. And that quality of life is so essential, but they just can't have a good quality of life with that degree of pain, right?
Absolutely not. Right.
Right.
Absolutely not.
So it
Yeah.
offers a lot of promises to pet parents out there that I have a situation like mine.
Yeah. So I do want to go back to that multimodal approach to pain management.
You got me. I was working my way back there right now, because I was going to say, so to help augment or as an adjunct to Librela, you recommend these other things, like you said, increase musculature and so on and so forth. So what are these multimodal therapies that you recommend in addition to Librela?
Absolutely. So the first one is if the dog is overweight, the dog needs to get to an optimal weight. And that can be done with a combination of diet and exercise, but gradual exercise, like controlled exercise. So that's number one. And there was actually a study that was done by Purina. And it was a really elegant study where they had these puppies that they raised from birth, and they just let them, live, and they monitored them. And they had from the same litter, they would match the dogs. And so one male in a litter would be, or one female in a litter would be fed as much food as a dog wanted to eat. And then another dog in that litter would be fed 3/4 of that amount of food. So he had sort of like, and so what you saw over the years, and these dogs just lived out their full life, you saw that you had a group of dogs that ate as much as they wanted and they got overweight. And then you saw these dogs that had a restricted diet and they stayed lean. They stayed at an ideal body weight. And when you follow these dogs through life, two things were dramatically impacted by that obesity. One is that the number of diseases that the dogs that were obese developed occurred 2 years or so sooner than the lean dogs, and one of those being osteoarthritis. And the other thing that you found is that the dogs that were lean lived 2 years longer than their overweight counterparts. And so that just goes to identify the role of obesity. And it's not just the extra weight, it's the whole metabolic issues associated with obesity that can contribute to not only disease, but early death. So it's really important to get those dogs to be as lean as possible. So that's one thing. And the other thing is to make sure that you have that restricted exercise, that they're able to get out and build that muscle mass back up again to all of those things that are important. And you can't do the weight loss without the exercise, and you can't do the exercise without the analgesia. So again, analgesia is sort of the umbrella that all of these other treatment modalities fit under, but those are sort of the essentials. It's the analgesia, and then it's the weight modification, diet restriction, and then exercise.
Yeah, cancer.
I'm really big on measuring out all of my dog's food. So you may have,
excellent.
It's when people, if I take care of somebody else's dog, oh, I just put some food in there. I'm like, no, you show me how much you put in there. And then I equate that to a cup or cup and a half. I can't just throw food in there for my dogs. And my dogs live on longer than most, because I've had some that are 14, 15, 16 years old.
She doesn't measure.
Maybe that's it.
She doesn't measure out my portions though at supper time. That's one thing for sure. But cancer being the other thing that obesity is linked to, the correlation between obesity and cancer is so high. I think I read a study recently that there are 81 human diseases that are so closely linked to obesity. That I think, Ginger, we've several times now we've talked about obesity and weight control with your companion animal and the importance of that. There's one thing's for sure, we're never going to be talking body positivity on Fuzzybutts and Friends. Get out there, get them exercise. And the other reason that you were speaking about, Dr. Campbell, is that you got to build up the muscles too. If the joints, or there's a problem in the joints or structurally anywhere, the muscles have to compensate for that. So you've got to get them out there. It's not just weight loss, it is weight loss in conjunction with exercise. And like you said, intelligent exercising where you're not doing any additional damage. That's
absolutely.
For sure. Let's see. Is there anything else? I'm kind of reviewing my notes here. I can never read them. It's all just scribble. So
we probably should talk about the dogs that shouldn't get Librela.
Great. Perfect. Let's do that.
Yeah. And so because one thing I didn't mention is that nerve growth factor, it's nerve growth factor, and it is a factor for nerve growth in the developing dog, right? Or we have it too in people. So if the fetus, the neonate, the developing animal, the developing person, it's essential for that. And so because of that, we don't want dogs that are breeding, lactating, or pregnant to receive Librela. The other dogs that we don't want to receive Librela are dogs that have had an allergic reaction to an injection. You wouldn't want to give that again. And then just for fair balance, when we looked at our clinical studies, the top 3 adverse events that we saw with Librela were urinary tract infections, skin infections, and dermatitis. But if you look at the incidence of those particular adverse events to the placebo control group, so we ran these studies with dogs that got Librela versus dogs that just got saline, the incidence of those three different signs were very similar to the placebo control. So we think that that is not a reflection of Librela. It's more a reflection of the population of dogs that were enrolled in the study. So I just want to give that fair balance to let you know that
Yeah, I
not
did
all dogs are, yeah. So anyway, yeah.
I didn't mean to interrupt you. My apologies.
No, that's all right.
I did have risks on here, and so those are the primary risks, which it doesn't sound like to treatment with monoclonal antibodies, but that doesn't sound like those are substantial risks. So you haven't really seen any bad adverse reactions so far.
No, dogs seem to tolerate this very well. And so again, we have a very active, what we call pharmacovigilance reporting system. And so we have a group that's their job is to take in, if people call in with adverse events, veterinarians call in with adverse events, we evaluate those. And pretty much what we're seeing is similar to what we saw in the clinical studies. So we're following that very carefully though.
That's wonderful. That seems to be the case with these type of treatments. The risk is a lot lower than with traditional treatments. How large? How many dogs did you study in your clinical trials? Do you know?
So we did two different studies. We did one in Europe and we did one in the US. And each of those studies had about 130, 140 dogs in the Librela group each. So that's about 280 dogs received Librela, and then a similar amount received saline. And that was for 3 months. So the dogs received 3 injections, and we followed them through for 4 months. And then for in the European study, there are dogs that were on that study that then could elect to go on and receive another 6 months of injection of Librela. And those were about another 90 dogs or so that went in and got a full 9 months altogether of Librela injections. So lots of dogs in the clinical study. And then we had, probably another, I can't say, but I would say close to, let's say 60, 70 dogs that were part of the initial safety investigation study before it ever got to the point where we put it in dogs that had osteoarthritis. So a number of dogs received Librela as part of the studies to get it to market. And then in Europe, since it's been approved, we're now at about 6.8 million doses sold in Europe. That doesn't mean 6.8 dogs receiving it because, dogs will get multiple injections, but we are in those millions of doses being sold in Europe. And again, kind of reinforces that safety and efficacy profile that we saw in the initial clinical study.
Yeah, that's a lot of dogs, and it's very promising. I know with Indiana, one of the things that as we're trying to really figure out what's going on with him, is it a peripheral neuropathy? We've ruled out disc issues, any herniations. We've ruled out cancer. But one thing that we're looking at is stem cell therapy. Is Librela, is it contraindicated if we decide to do that, or can those be used in conjunction with one another?
Yeah, you can use them together. We don't have any data that we've actually evaluated them looking together, but just knowing how both of the two treatment modalities work, there isn't any initial indication that you wouldn't be able to use them together. So that would be your veterinarian's decision if he wants to use them together. But right now, we have no indication that there would be a reason not to use the two together.
There's my Nana Banana, a handsome little boy.
Oh, I love that.
He's up. He's 12. He's 12 now. He's up and moving it around. So he's happy. He's got a good quality of life.
And that's him on your painting in the background also?
Oh, this painting right here?
Yeah.
Oh, no, that's Hudson. I just lost Hudson.
I'm sorry.
A few years ago to mast cell tumors.
Yeah,
I've lost 3 dogs and all 3 to cancer. So, so knock on wood, Indy does not have cancer yet, although we just pulled a tumor off his epiglottis and we're having a biopsy right now. So absent of that, we might consider stem cell therapy, but at least theoretically, it doesn't seem like there could be any reason why you could not give those as adjunct treatments, right?
Not with the information that we have now. Again, we
Right.
haven't thoroughly studied that,
Yep.
but based on what we know about how the two different treatment modalities work, it doesn't seem like there's any contraindication at this point in time for the two.
Okay, so pet parents who have kids with osteoarthritis, how long do they have to wait until they can get some of this wonderful, promising new drug, Librela? Did you say September, the fall?
This fall, so probably I would say October, November-ish. We should have it in the United States. We should have some supply.
And do they
So,
need to go see a specialist, or can their general
no,
practitioner?
general practitioner can manage this. So yeah, they can just go right to the general practitioner.
Is
I
Zoetis doing
guess
a pretty competent job of getting the information out there to GPs? There are a lot of them out there.
yes, we do. Right now, we're having monthly webinars that GPs can talk, attend. We also have our field force, our veterinarians out there talking to different practitioners, and then we meet with different groups, bring them in together to give them all the information. So we are trying as hard as we can to get that information out so that the veterinarians have information that they need to decide what is the best analgesic for that particular dog in that particular situation.
All right. Well, you heard it. If you have a kid, Fuzzybutt, with osteoarthritis or has some pain management of an undiagnosed and uncertain, go to your GP, your veterinarian, and start talking to them about Librela and learning about it. And hopefully, it'll be available to you soon to everyone who's listening today. Dr. Campbell, is there anything that I left out? I've been going over my notes and thinking about it. Is there anything else you'd like to add about Zoetis and Librela?
I think, thank you. It was very thorough. You had great questions. I just think because, again, as we talked about in the beginning, those signs of osteoarthritis can be um, uh, so gradual, not really prominent, that it would be helpful if people do an evaluation. And so we have the dogoachecklist.com. Pet owners can go in and take it. It's a very simple survey. It asks 6 questions on the front. It asks 4 questions on the back. They should go in, download that, fill that out, and then the next time they go to their veterinarian, bring that with them, and they can start the discussion about osteoarthritis. Because I bet you at least 40% of your the dogs out there that listen to your podcast have osteoarthritis. That's have the pain associated with osteoarthritis. That's what our data shows us. So there's probably a lot of dogs out there that haven't been diagnosed, and taking that checklist, going through that questionnaire is going to get them one step further to making the diagnosis.
And there are millions of dogs out there that have osteoarthritis that should be listening to the show, but aren't yet. So we hope to get those listening to the show as soon as we can to get access to important data like that. Dr. Campbell, give us that URL again so I can write it down and our audience can write it down to go do that checklist and find out if their dog is a candidate.
So it's dogoachecklist.com.
Okay, I will put that in our show notes as well for our audience. We've reached that time of the show. I think, Ginger, where you tell me I screwed up so many things, I got to go back and edit the whole show. We probably have to reshoot it. What did I leave out this time, Ginger? What did I do wrong?
I did have a couple of questions going back like to the beginning and the middle, where we talked about, things that would help you, weight loss and exercise. But when we talked about having Indiana going to a physical therapist and getting acupuncture and actually even going to a veterinary chiropractor, I saw your eyes kind of light up. So did you have anything that you wanted to say about those? Are we missing any specialty out there that we should be having done for Indiana? Because we're gathering all of our tools to put in our toolbox, as Luke says.
I think again, you're kind of hitting your Indiana's weight loss is perfect. So you've got that under control. You're doing the rehab. Acupuncture can be helpful. I'm not sure about chiropractic. I don't have any experience in that. And then you're talking about the stem cell therapy. So I think you're hitting the big ones. And I think that if there's anything else needed, your veterinarian sounds like she is right on top of it, and would recommend it as appropriate for Indiana.
Okay, thank you.
Here's a corollary question to what Ginger was just asking. Do you find that dogs that are more receptive to NSAIDs are more receptive to Librela?
So it's hard to say. I guess the cases that we have seen where we've got the videos of are dogs that have been on an NSAID. It's helped them a little bit, but Librela has taken them that step further. But that's not to say that's going to be, we've not really evaluated that close, you know. So I think in general, if a dog is first being diagnosed with osteoarthritis, the veterinarian will interview the pet owner, look at the dog, and then have that conversation as to should we use a monthly injectable such as Librela or a daily NSAID, you know? So that's kind of the conversation. And that is a combination of veterinary's preference, pet owner's lifestyle, and then what's best for the dog. And as far as then dogs that have are already on NSAIDs and they're not quite reaching their goal,
Right.
I think Librela is then a nice additional or new medication to add to it. But for that first diagnosed dog, the first time they're diagnosed, again, whether you go with an NSAID or Librela, really is that conversation between the pet owner and the veterinarian.
Well, that's what I was asking. Indy's at the point where he's responsive to NSAIDs, but I want to see if we can get him better still. So that's why I was picking your brain to see if that it's good he's responding to NSAIDs. Now we feel like Librela, he can be doing a little bit better or maybe a lot better. So I'm I'm at that point right now. We'll try anything. That's how I view it as a pet parent is, and also the host of this show is we like to provide pet parents with a big basket of treatments or therapies that they can use for their companions and their Fuzzybutts, and then go out and try it and see what works. So with Librela, in Indy's case, Dr. Campbell, it looks like I'm probably going to, based on this conversation, try it out, try some injection. So how long do you recommend, for how many months should it be, bioavailable, metabolized, and in their bloodstream and working? How many months should we give it to see if Indy sees any improvement or not? How many months worth of treatment do you think?
So I think count on 2 or 3 injections.
Okay.
Because what we found in our study is that they'll usually respond definitely after the second. If they're going to respond, it's definitely after the second injection. In many cases, it's after the first injection. But then the other thing that we found is that those dogs will continue to improve up and through about the 6th injection. And then after that, they maintain that level of comfort. And the reason for that is that one, there's a lot of pathology there that we're not going to change. But 2, maybe that after that 6th injection, they're back to where they were before. And they're really, that's as good as they're back to their old selves again. So a minimum of 2, possibly 3 injections before you decide that it's not working.
Yeah, well, I'm probably going to have more towards like 6 months though, because I'm the kind of pet parents like, oh, any improvement I see, it's like, oh, it's working, because you want want it to work. So
and that's and I just not to interrupt you, but that's where the OA checklist comes in really handy, because in taking videos, I think that's the other really important point, is taking videos, how Indy is now, and then taking videos after he's been on Librela, to document that improvement. And therefore, it's not like you're remembering, but you're actually visualizing. And then when he gets to that place where, he's at the best he's going to be, then you can also go back and say, oh, look, he is better because this is where he was before, and look at how much better he is now.
That's a great pet parent hack, Dr. Campbell, and not only just for osteoarthritis, for any condition. Pet parents out there, film as much as you can. Show the footage to your primary care, your veterinarian, or your specialist, whoever you're dealing with, and then watch it over time, because that's data. That's important data. Those are data points that can so you can better understand exactly what's going on with your kid. All right, Dr. Campbell, we ran a little bit long, but it was wonderful talking to you. I'm so excited about the promise of Librela. Not just a promise; it sounds like it's proving and it's performing as you hoped it would. And we will certainly let you know. I'm 95% certain I'm going to try Librela with Indiana, but we're still running a couple of tests, and I think we're going to do a couple of things before, I'm sure. So we will certainly use him as a use case for Zoetis and you guys, and let you know how he does with Librela. All right. Thank you, everybody, for being a part of this show. Dr. Campbell, thank you for being here on Fuzzybutts and Friends.
Thank you so
Thank
much.
you for having me.
And,
yeah,
and you
nice to meet all of you.
Thank you. And you were always welcome back here, Dr. Campbell, to talk about not just Librela, but any other developments that you have in pain management, in any other areas of animal science and health. You're more than welcome back here to use Fuzzybutts and Friends as a platform for you.
Okay, excellent. Well, thank you so much.
I did have one more question, though. I just realized it. Is that
okay.
Zoetis does not have a cancer drug for companion animals, does it?
We do. We have Palladia for mast cell tumors.
I can't believe I forgot about Palladia. I can't believe that. But cancer is not, when you talked about the 3 areas of disease areas, cancer is not one of them for Zoetis.
It's not a primary pillar. Not at this time anyway.
All right. Well, I'm going to start writing letters to your CEO. It's got to be there are 6 million new. I don't know how many new cases of osteoarthritis there are out there, but there are 6 million new cases of cancer in dogs. So we need more. We need more artillery out there, more quivers, arrows in our quiver of treatment. So, okay.
Well, I'm going to interrupt you for a second and put a. Yeah, I always have to interject my dog. So my dog Lily was actually on Palladia for a year. She had stomach cancer, and so she has been off of it now for a year, and she, knock on wood, is going to be 16 in November.
Awesome. So, I'm glad to hear. I'm so happy to hear that for you. So, very good.
Palladia
Thank you for Palladia.
Yeah. You do take good care of your pets. If you've had a dog with cancer that's 16 and still
she had stomach cancer twice, actually.
Wow. Excellent. Well, good. You do take excellent care of your dogs.
I call her my $30,000 dog.
Yeah, for those of you who don't know, Palladia really was a game changer, and I still think they're looking for all other indications of usage and other cancer types out there. So Palladia really was a platform drug, I think. So Zoetis Animal Health, you and Zoetis have done some really wonderful work for our companion animals and our Fuzzybutts. Thank you very much. Thank you, everybody, for tuning in this week. You can find this podcast on Spotify, iHeartRadio, or you can watch this on our YouTube channel at fuzzybuttstudios.com. Until next week, puppy up. Talk soon.
All right.
Bye-bye, everybody.
Bye.
Hang around, Dr. Campbell. Don't go yet.